Hi, my name is Francesca. I'm a Walla University nursing student. I'm going to perform hand hygiene. Oh!
It's on the inside.
Can I have your name and date of birth?
Ashlyn
gosh,
Melvin. Okay. Ashlyn Melvin, 11/28/1999.
Okay, let me check your wristband. Perfect. Do you know where you are today?
I think I'm in the Walla Walla clinic.
Okay, do you know who you are?
Ashlyn
Obviously.
Melvin, yeah.
How did you get here?
I drove here.
Okay, do you know what year it is?
2024.
Do you know who the president is?
Biden.
Correct. Okay. Is it okay if I perform a head-to-toe assessment on you today?
Yeah, sure.
Okay, perfect. So first we're going to start with the head. I'm going to examine your head, scalp, and face. I'm just checking for any flakiness, dryness in your scalp, that your face is symmetrical. It is. Looks good. There's no dryness or flaking in your scalp. Can you smile for me? Can you raise your eyebrows for me? Make a bubble with your face. And then keep your eyes closed. Perfect. I was also testing for cranial nerve 7, and it looks like that's all good. Next, I'm going to palpate your head for any tenderness or masses. Let me know if any of this hurts. Nope. Okay, perfect. I'm going to assess your face for sensation, so I'm going to do a sharp dull test. And this is going to be assessing the trigeminal cranial nerve 5. Okay, so this is going to be sharp. It's going to be dull, okay?
Sharp. Sharp. Soft. Dull. Soft.
That was soft.
Yeah. Sharp. 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 Soft. Soft.
Okay, perfect. You can open your eyes now. You had a little bit of right-sided, I don't know, sensation loss. Yeah. Next, I'm gonna palpate your TMJ, so I'm gonna have you open and close your mouth. Does any of that hurt?
No.
Okay, perfect. I'm also going to palpate and check for your sinus regions, which are frontal and maxillary. Let me know if anything hurts. No? Okay, perfect. Next, I'm going to assess your neck, and I'm going to be looking for JVD, jugular vein distension, and then I'm going to palpate and listen to her carotid arteries. I don't see any JVD. I'm going to palpate your carotid arteries. They're both strong bilaterally. I'm going to listen to them, check for any bruits. Using the bell of my stethoscope. Nice. Okay, whoa. Now I'm going to check cranial nerve 11. So I'm going to, which is your accessory, I'm going to have you shrug your shoulders against resistance. Good. Perfect. Next, I'm going to palpate all of your lymph nodes. And this is number 1 is your preauricular, postauricular, tonsillar, submandibular, submental, occipital, which is behind her head, superficial cervical, superficial deep, posterior, and then supraclavicular. All of that's good. I'm also looking for skin tuger, and that's good. Next, I'm going to inspect your eyes. Have you close your eyes for me. I'm just looking for anything abnormal on the exterior part of her eye.
I've got eye UVs.
It's okay. So her skin looks good. There's no weird funky discharge in her lacrimal ducts. I'm going to have you open your eyes for me. Her sclera and pupils look good. Now I'm going to assess cranial nerve 2, which is her optic peripheral vision. For fields. I'm going to have you cover one eye, and I'm going to cover the same eye. Okay? Let me know when you can see. Oh, wait. Yeah.
I can see it.
Here.
Yep.
Here.
Yep.
Here.
Yep.
Switch eyes. Here.
Yep. Yep. Yep.
Perfect. Okay, next I am going to check your 6 cardinal fields, which is cranial nerve 3, 4, and 6. So this, I'm going to have you follow the light using just your eyes. Don't move your head. Perfect. Now I'm going to test your corneal reflex, which is just the cotton wisp. It's going to feel a little uncomfortable maybe. Good. Good. Strong in both eyes. And that was cranial nerve 5. Next, in the trash. Next, I'm going to examine your eyes. Your eyes. Okay. Have you just look straight ahead at me? Good. Nice. There was good. Good. That was cranial nerve 3. There's good pupillary reflex. Next, I'm gonna also check for accommodation, which is also cranial nerve 3. Just take a look at the pen light. Good. That was good. Next, I'm going to inspect and palpate her ears. And I'm going to start by palpating the external ear, making sure and looking for placement and size and alignment of the ears. Are you having any pain around your ears?
No.
Good. They're both aligned. Not sticking out too far. Next, I'm going to look inside her ear and check for a pearly gray color and make sure that she doesn't have any nasties in her. Okay, so I'm going to pull it up. Let me know if any of this hurts. Good. Good. Next, I'm going to test cranial nerve 8 by doing the auditory hearing whisper test. I'm going to whisper 2 words behind you on each ear. I want you to repeat back to me what you hear.
Soccer ball. Pizza.
Okay. Next, I'm going to perform the Weber test, which is cranial nerve 8. I'm going to place this on top of your head. Let me know when you stop hearing it.
I can hear it.
In both ears?
Yeah.
Perfect. Next, I'm going to perform the Rin test, which is also cranial nerve 8. And this is the vestibular cochlear. This one also includes air conduction. Let me know when you stop hearing it.
Stop. Stop.
Okay.
Stop. Stop.
So it's a little bit longer in this ear, which could mean that her hearing is better in that ear. Could just mean I didn't hit it as hard. Next, I'm going to assess her nose and smell. which is cranial nerve 1. So first I'm going to look at her nose and check for any abnormalities, any deviation of her septum. Probably look that. Perfect. Next we'll do smell, which is cranial nerve 1. Close your eyes for me. Can you smell it?
Yeah, that's hand sanitizer.
Okay. And then cover your other nose.
That smells like lip balm.
Perfect. Okay, next I'm going to look in your nose, check for normal mucosa and moistness. All right, can you move your nose from side to side? Checking for a deviated septum. She doesn't have one, and that is intact. Next, I'm going to inspect her mouth, looking for color, her gum, looking at her gums and teeth. All of it looks good. I'll have you open your mouth for me. Move your tongue side to side. Perfect. Say ah. Looking at her soft palate, looks good. Then that was cranial nerve 12, which is her hypoglossal. And then I'm going to test cranial nerve 9 and 10, which is your ability to swallow and cough. So can you swallow for me? Can you cough for me? Okay, those are good. The observation of her soft palate and uvula was also cranial nerve 9 and 10. And I'll use the tongue blade so I can see your uvula. Can you say ah? Okay, perfect. Next, I'm going to check your gag reflex, which I guess I could do with this. This is also cranial nerve 9 and 10. Say ah again. Okay. Next, we're gonna test cranial nerve 7, which is facial, and that's gonna be the sweet and salty. So I'll have you close your eyes for me.
Oh, that's sour.
Okay, ready?
Sweet.
Alrighty. Okay, so that's good. That was cranial nerve 7, 9, and 10. Next, sorry, do you need a drink of water?
No, I'm okay.
Okay, well, now that you're sitting, I'm going to take a listen and inspect your pulmonary system. First, I'm going to look for symmetry, diameter, and respiratory effort. So can I pull this down a little bit? So I'll confuse maybe a little bit. So her chest is symmetrical. Could you lift your arms above your head and breathe in, out, and then looking at the diameter. It's good. It's about double from her chest and is on her side. I'm going to palpate her chest for any tenderness or masses and crepitus. Let me know if you feel anything that hurts you. Did anything hurt you? Perfect. I checked for chest excursion when I did her initial assessment. Next, I'm going to check for tactile firmitus. So I'm going to put my hands on you and have you say 99.
99? 99?
Okay, I'm going to go around her back and do it.
I can just turn it.
Or turn the other way.
That way?
99.
99.
Okay, that's good. Next, I'm going to percuss her anterior, posterior, and lateral lung fields. Okay. Okay, lift your arm up for me. Okay, can you flip around for me? Okay, perfect. You can go ahead and turn back around. I'm going to now auscultate her chest and her lung fields using the exact same pattern. So.
Okay. So you're lying down. Straighten your hips. Right?
Oop. I'll have you flop around for me.
Inside, cross,
Alrighty, perfect. Next, I'm going to move on to her cardiovascular assessment, and I'm going to listen to her heart, starting with her. Her second intercostal space, which is her aortic. Her second intercostal space towards the left, which is her pulmonic. Her third, which is Erb's point. That sounds good. Next, I'm going to do her fourth, which is her tricuspid. And then her fifth, which is her mitral. Good. That all sounds good. Okay, I'm going to have you lay back, flat on your back. I'm going to now assess her abdomen. Okay, I'm going to have you flex your knees. Yes, and then I'm going to go ahead and drape you. You go ahead and put this back on if you would like. And I'll just lift this up. Okay, so first I'm going to inspect, auscultate, percuss, and then palpate. So first I'm going to inspect, looking for any protrusions. Her stomach is flat, which is good. I'm inspecting, looking for symmetry, and her stomach again looks good. Next, I'm going to auscultate her bowel sounds and her 4 quadrants. Her bowel sounds are very quiet. Have you had anything to eat recently?
No.
Makes sense. Next, I'm going to auscultate her aortic, renal, iliac, and femoral arteries. And Okay, those sounded good. Now I'm going to palpate her four quadrants, first superficially and then deep. Let me know if you have any pain. No? Good. Okay, now we're going to palpate deep. Perfect. Next, I'm going to percuss her costovertebral angle, which is right here.
I'm good.
And then feel for her, palpate her abdominal aorta. It's normal. I'm going to have you sit back up now and sit on the side of the bed. I'm going to inspect her hands and cap refill. Good. It's under 2 seconds. Her hands look good. Next, I'm going to test range of motion. So I'm gonna look at your neck. Can you move your head side to side, and then up and down? Good. Neck. Oh, okay. Next, I'm going. That was cranial nerve 2. Next, I'm gonna look at your shoulders. So I'm going to inspect your shoulders. They look symmetrical. Feeling any tenderness or weakness? Feels good. Can you lift your arms straight up? Okay, can you put them straight back down? Can you put them in front of you? And can you put them behind you? That looks good. Next we're gonna check your elbow. Push against my arm. Okay, and pull. Okay, good. Her elbows look good, at least on this arm. Okay, push against my arm. Pull. Her elbows look good. Next I'm gonna look at your wrists. Put your wrist up towards me, and then around. All right, her wrists are good. Now we're going to check her fingers. Can you squeeze my hands? Perfect. Fingers are good. And I was also able to test her grip strength. I am going to now test her peripheral pulses. So if you want to lay back for the sake of the camera. Oops. Okay. So I am. Oh wait. Scratch that. I need to do her radial pulses first. So I'm gonna grab both your arms. They're equal bilaterally. And then you can sit back up. Sorry, I got confused for a second.
That's okay.
I was gonna do pulses on both, but next I'm gonna have her do stereognosis. So I'm gonna have you close your eyes. I'm gonna put several objects in your hands, and I want you to tell me what they are.
A button. Paperclip.
Alrighty. Next, I'm going to test 2-point discrimination. So what this is it's going to poke you in your palm, and it's going to start far apart, and then I'm going to move it closer and closer and closer each poke, and I want you to tell me when it feels like there's only one prong poking you, okay?
Oh, thanks.
And we're able to use that, right?
Yeah.
They're like lying
One.
down and stuff.
Okay, that was pretty good. It was about right.
Yeah.
There.
Put it on 0.5.
Alrighty.
That's how I'm not using it.
Huh? No, this one.
And it works.
1.
Alright, that one she had a little bit farther, about this distance. Next, I'm going to do a neurological exam of her coordination and function, accuracy. So I'm going to have you take your finger and put it to your nose. Other finger to your nose. Okay, perfect. And then I'll have you stand up for me. And then I'll have you turn this way, move this way, and then I'll have you put your heel to your shin. Or just like lift it with this. Okay, now do the other one. Okay, perfect. You can have a seat. And I'll have you lie down because we'll move into your lower. But first, can I have you put your hands up, down? Okay, perfect. I'll have you lie back. Let me adjust this back. Okay, I'm going to first look at her hips and check for symmetry, any pain. Okay, good. I'm gonna have you raise your leg up and lay that one flat. Okay, push against my arm. Push against my arm. I'll do it to the other leg. Push into my arm. Push into my arm. Can you swing your leg out one at a time? Perfect. Swing the other leg out. Good. I'm checking for range of motion in her hip and muscle strength. Okay, now I'm gonna have you stand up for me. Sorry, I keep making you move. Okay, I'm looking for body alignment and symmetry, and everything looks good. I'm gonna have you turn around, and we're gonna perform a scoliosis check on you now. So I'm gonna have you hang forward. Don't worry about touching your knees. I'm checking to make sure her spine is straight, which it is. Alrighty. Now I'm going to have you balance and do a heel to toe walking. Good, perfect. I'll have you sit back down. Readjust this again. Okay, now I'll have you lay back down so that I can palpate your peripheral pulses in your lower extremities. Okay, those feel good. And I'm going to assess her ankles and feet, her cap refill as well. Her ankles look good. Can you push against my hand? Then push up, push down, push up. I'm gonna test your cap refill. Both under 2 seconds, which is perfect. Her feet are a little cold, but that's totally fine. She has no edema. And next I'm going to check your range of motion in your knee. Can you lift your knee up for me? And then can you extend your knee? Perfect. You put your foot down, lift your knee up for me, bend and then extend. Perfect. And next I'm going to check range of motion in your ankles and feet. I already checked her strength. Can you move your, perfect, can you move these? Perfect. Now I'm going to do a tendon reflex test, so if you could sit up for me, just hang your feet off the sides of the bed. You don't need to touch the floor or anything. First we're going to do the biceps. So, I will... Okay, that's good. Next is the brachioradialis, which is down here. Okay.
I was like,
I have a very good patient, as you can see. Next, we're going to check the patellar. I'll move my camera.
Were you guys filming
Okay, perfect. Next, we're gonna do the triceps. Okay, the other one. Perfect. And then we're gonna do the Achilles. Can you even see your feet? I don't think you can see. Alrighty. And then last we're gonna do the plantar flexion test. Her toes should curl. Good. Alrighty. You can cover yourself up. It looks like we're all done here. I'm gonna move the bed back down to its lowest position. Your call is right there. Let me know if you need anything. Thank you for letting me come assess you today and to perform hand hygiene. And we are done.